Again today, we get it. Thank you, Micah.
All right, for a lot of women who've used a midwife in childbirth, it's an experience that is very dear to their hearts.
Frontier Nursing University is celebrating National Midwifery Week, and here to tell us more about some special events that they have planned and also just about the profession is certified nurse midwife Kendra Adkisson. It's good to have you with us. Thank you very much.
Thanks so much for having me.
Yeah.
So you're here to call attention to your profession,
Yes,
which is
we are.
pretty interesting. Tell us about what you do for a living.
Well, it's a great profession. I'm a certified nurse midwife. We attend deliveries in the hospital. I work at Womankind Midwives and I deliver at St. Joseph East. So there are midwives nationwide that take care of women prenatally, through the birth, and postpartum.
And what were you saying is the most common question you get asked by moms?
I think the most common question is, when do you think I'm going to have this baby?
Okay.
And unfortunately, when we graduate, they do not give us a crystal ball.
Would you say, you know, it's an exciting career?
I can't think of a more exciting career. We get called in the middle of the night. You're there for the birth of a human being.
Yeah.
Really get to make that day how the woman wants it. You know, it's a sacred time.
Yeah.
It's an honor to be present during that.
So it's not the typical 9-to-5 office job, it sounds like.
Sometimes I wish that, but no. Babies aren't scheduled, and that's part of what midwives do. We allow it to be a normal, natural process, so, you know, we don't lean towards inductions or unnecessary medical events. We let events unfold as they will, and usually that's about 2 a.m.
Yeah.
Now, Kendra, you've been at this a while. Do you ever notice that there are trends that happen at certain times? Does the weather make a difference?
He was just talking about hail, and I thought, you know what, that's going to bring the babies. So I haven't noticed the correlation with the full moon, but the barometric pressure, possibly.
Yes, exactly, right? Barometric pressure, as we say. So what do you think it is about midwifery that maybe, you know, people have misconceptions about?
I think when people picture a midwife, they think that they're at home or, you know, kind of back in the pioneer days, but really we're modern midwives. We're working in the hospitals with a team, with physicians, neonatologists, anesthesiologists, so we can provide the care that a woman needs should events arise. We work with a physician who is able to do a C-section or step in if needed. But most normal, healthy women, a midwife can meet all of their needs.
What is the preparation like? What is the program like if people are interested in becoming a midwife?
Nurse midwives are nurses first, as the name suggests, and then they go on to get a master's degree. So at Frontier Nursing University, you know, you would enter as a nurse, get your master's degree, and then work with a nurse in your community wherever you live. We have students in all 50 states. Do a certain amount of deliveries, get board certified, and then you're set to go.
And obviously the healthcare setting, one of the fastest growing in terms of job creation and adding new jobs. So
absolutely, and with women having access to care, midwives are in greater demand.
Okay.
Well, you invite people to find out more. They can visit frontier.edu for the Frontier Nursing University. Thanks for coming in.
Thanks so much for having me.
Thank you.
Fun profession you have there. Hey, coming next with Halloween.